I'd first like to begin by asking, it's not just Raju Srivastav. There are so many other people in their 20s, 30s, 40s who are getting strokes. Why do you think this is happening?
So I think firstly, we've got to understand that over the last 20 years, heart disease in the young people has been rising.
Yeah.
Coupled with that have been lifestyle changes. Clearly, the fact that people are exercising less to sitting down and working, the atmosphere of competitiveness has increased, so stress factors have increased. Eating out has increased, so trans fat foods have increased. Sedentary lifestyle has become more common, under stress all the time, meeting deadlines in the younger group. And finally, pollution also has a part to play. So all this combined together is a multifactorial issue about rising heart disease in young Indians.
So how much working out is actually healthy?
A very important point, and we talk about lifestyle diseases.
Yeah.
And that's true. Lifestyle diseases are all taken care of by healthy exercise.
Yes.
You raised a very important point, and I want to reemphasize that. You raised smoking, and I tell you, smoking has increased tremendously.
Absolutely.
Over the last 30 years.
Yes.
And that I still want to advise your viewers is the biggest, most important risk factor for developing heart disease as well as heart attacks, especially in young people and especially suddenly. For example, some of the issues you raised about people severely exercising and getting a heart attack happens commonly more in smokers than in non-smokers, because that leads to thickening of the blood. And suddenly on increased exercise or heavy exercise or severe exercise, clotting precipitates in the heart coronary arteries, especially in smokers, to result in sudden cardiac death or a sudden heart attack.
Right.
So now the very important aspect you raise is that because certain celebrities had heart attacks during exercise, during gymming, or after heavy exercise, has they raised the concern about exactly what you asked, is exercise good for the heart, or what sort of exercise is good for the heart? So we've got to realize that exercise does decrease heart attacks by 25%. But the exercise we say is aerobic exercises for approximately 40 minutes, 5 times a week, which sums up to 200 minutes, more than approximately 200 minutes a week, which therefore means you have a 5 minutes of warm-up period, 35 minutes of brisk walking, and 5 minutes of cool down. That is heart healthy exercise. Anything beyond that or anything for a more longer duration only helps your stamina, may help weight loss, but is not necessarily any more beneficial to the heart.